Hello, today we are going to share about the relations between fungal infections and COVID-19.
Introduction. Coronavirus disease 2019 or COVID-19 has been sweeping across the globe. According to researchers from Imperial College London, COVID-19 patients could be more susceptible to fungal infections. Fungal infections occur when an invading fungus takes over an area of the body and is too much for immune system to handle. Critically ill patients, especially the patients who were admitted to the intensive care unit (ICU) and required mechanical ventilation or had a longer duration of hospital stays, were more likely to develop fungal co-infections.
Types of fungal found in COVID-19 patients. There are a few types of fungal found in some of the COVID-19 patients. One of them is Aspergillus flavus. This fungal will produce mycotoxins which can cause acute liver damage. This fungal can be found on dead organisms such as dead leaves or dead animals. Next is Candida. Candida can cause infections if it enters bloodstream or internal organs like feet. Other than that is Mucormycosis fungus, which can cause infection in lungs for those who have weak immune system. But this fungal is not that harmful. Lastly is Cryptococcus. This fungal will infect your lungs if you have weak immune system and breathe the fungus in. The most common Cryptococcus is Cryptococcus neoformans or Cryptococcus.
Shock, sepsis, and organ failure were linked with lower fungal diversity and also tied to worse injury to the lungs, more intensive treatment, and elevated levels of a protein called pentraxin 3 as an indicator for inflammation and disease severity. The samples of fungus mainly found in material collected from COVID-19 patients with allergic bronchopulmonary, aspergillosis, and other disorders, which include chronic granulomatous disease caused by a genetic dysfunction that affects the immune system and chronic obstructive pulmonary disease, including chronic bronchitis and emphysema. At the early phase of the disease or with extrapulmonary fungal infections, it may present with a typical chest imaging.
Mode of transmission: inhalation of airborne conidia, contaminated water or water surface that is exposed to conidia, nosocomial infections such as poor hygiene management in hospitals.
Above all, people need to inform themselves and the rest of the community so that together they can develop a policy to discourage fungal infection. By educating themselves about fungal in COVID-19, government and nation citizens have the knowledge to set up effective programs and structure both within the community. And although fungal infection will never be fully eradicated and must be dealt with as soon as it occurs, increasing awareness of the problem is making Malaysia a safer and more enjoyable environment in which people can live.